Good afternoon, ladies and gentlemen. I'm Dr. Sarawut Boonsuk, Deputy Director General of Department of Health, Ministry of Public Health, Thailand. Today, I'm going to share with you about the strategy responding to COVID-19 in the topic of health literacy promotion and prevention measures to citizen engagement and multi-sectoral cooperation. Thailand's success on response to COVID-19 pandemic. This is outline of my presentation. First, I will share experience about the overview of the COVID-19 situation in Thailand. And the next is the Department of Health strategy to respond on COVID-19. And the last topic to challenge and the way forward. I will start with COVID-19 situation in Thailand. On the 9th of December 2020 or yesterday, Thailand has 4,151 infected cases in total, with 60 deaths and 3,880 recovery and 211 patients are still in the hospital. The Department of Health strategy, Thailand, our key mission are preventing and reducing the spread of the disease by focusing in the all age group through systemic environmental health management. We also promote health literacy to the people and encourage people to have appropriate behaviors to protect themselves during the pandemic. Department of Health strategic response to COVID-19, we deploy strategies in many levels, establishment, upgrade and improve standard and guideline on public health measures for business operators to prevent transmission of the disease. Community and local, we monitor and evaluate preventive measures at establishment for health safety of public. At individual level, we created health literacy, promote public health measures, and enhance rich communication. And we promote citizen engagement and multi-sectoral cooperation for all, and implement public health measures according to public health law of Thailand. I would like to share 4 main strategies to respond COVID-19. The first one important strategy is we have developed Thai Stop COVID or TSC platform as a source of knowledge for the public, business operators and officers. We scale up public health literacy to TSC platform for business operators to comply with the standard. Users could perform self-assessment by using TSC platform. Once you go to the hotel and you notice something or want to send your complaint about the COVID-19 response of that hotel, you can scan the QR code on the hotel's e-certificate as shown on the left side, to keep it as a source of knowledge for the public. If there are more than 3 complaints with the same area, the information will be sent to be further checked. For more campaigns on improving standards and guidelines on public health measures for business operators, we also enhance the standards of safety, hygiene, and environmental sanitation to set a goal of new normal. This measure has been implemented within restaurants, fish market, hairdresser, golf course, food delivery services, and more places to boost confidence of the people in using services during the outbreak and during the easing of the lockdown in various phases. Next strategy is creating health literacy and promote public health measures and enhance risk communication. We have developed knowledge, sets recommendations and guidelines for the people's daily life, and develop a comprehensive risk communication and response system or RRHL, which is reachable for all target groups. About key activity on promote health literacy, you can see on this slide. We have a campaign for enhancing Thai people to wear masks to protect themselves from COVID-19 and promoting appropriate health behaviors with 3R, which are reduce, reframe, and responsibility. We also have big cleaning campaign for public transport. shopping malls, fish market, restaurants, sport place, gym, condominium, and school. And the last one, social distancing measure. And for key activities under citizen engagement and multi-sectoral cooperation, first we try to strengthen communities' capacity to prevent COVID-19. In order to do that, we integrate work with Ministry of the Social Development and Human Security targeting the vulnerable group in 5 areas, which are consumption of central kitchen, financial support, career or income, housing, and the last is health. Then we develop the model and guideline for empowerment of the community to promote good health and safety from COVID-19. For the collaboration among government, private sector, and Thai citizens, we join targets and plan. We have the measures or standard and a monitoring system such as risk factor monitoring, like people behavior, business operators, and a new case. Next is the study and manage the result of health impact assessment, which this should be covered at all age groups. Thirdly, respond when a case emerges after a lockdown, easing by investigating, responding to the case, and creating knowledge management for the situation. And health promotion and environment health practice on new normal, such as a light cost approach and protection and prevention new normal services. The last strategy is promoting citizen engagement and multi-sectoral cooperation. In this area, we focus on creating local mechanisms on health promotion and environment health. And we also promote and strengthen the capacity of the public sector to participate in the prevention and control of COVID-19. I will tell you about the process we use to introduce new normal way of life to Thai people. The picture below, you will see the process which begins with the surveillance, then creating measures and the standard. After that, we continue to improve it. The public side to the people along with setting up monitoring system. Lastly, we announce as a new normal and enacted on Public Health Act. My last slide is about the challenge and way forward. Recently, Thailand found new cases of COVID-19. The way forward to tackle this situation include monitoring the situations and promote health in the new normal practice to improve public confidence. The second method is promoting health literacy and good environmental health for every sector for health protection, including wearing masks in public place and washing hand hygiene of public place, cleanliness, minimize risk from common contact point, and maintaining environmental health standards. And the last point is cooperating and communicating with network partners and Thai citizens to prevent spreading of the disease. This is the end of my presentation. Today is Thailand public holiday, and I joined the conference in a remote area which had poor internet signal. So if you have any questions, you can leave the question to the organizer or contact me directly by email in this line. In the next 2 years, Thailand will host Asian Health Literacy Association Conference in 2022. It is my pleasure to welcome you all in Thailand. I hope that the situation is safe for travel at that time, so we can see each other face to face. Lastly, I would like to give my sincere appreciation to the organizing committee for arranging this webinar. Stay safe and thank you very much for your attention. สวัสดีครับ